I feel obliged to make one more video about a topic that's really not covered in allopathic medicine, and that is the topic of trigger points. Trigger points are tight bands of muscle which can cause what's called myofascial pain syndrome. We don't really understand what causes it, but you will see this commonly in practice, and this method will enable you to reduce their pain by about half in a matter of a minute or two. So typically, people will say, my neck hurts, my back hurts, my low back hurts, but these can occur anywhere, including the abdominal wall and elsewhere. These are palpable bands of muscle that you might assume are normal, but they are tighter. They will also sometimes radiate neurologic symptoms, for example, in this spot, down to the hand or fingers, and they'll also skip. So as you drag across the muscle, it'll be as if you're pulling on a rubber band and it'll snap back. Those are some characteristics of what you're feeling, and people will say that it's tender. It's kind of an odd pain. It's almost nauseating. It's not pain from the immediate area. There's sort of a core pain, and I can't describe it, but it's almost a nauseating feeling. So I have my typical medical student here who studied too long, and he has a tight band right in the front of his trapezius. So I'm going to ask him how far he can move his neck, rotate it to the right, and it's really not as far as it should be. What I'm going to do is I'm going to pull forward with these fingers onto that trapezius, and most of you guys have a tight muscle in here. Now, this is the hard part, because you're going to be doing this for 2 or 3 minutes, and you have to be some kind of conversationalist to keep up with the patient. And nothing will happen for 2 or 3 minutes, and after about that time, you'll actually feel the muscle slowly relax. And as that relaxes, you just keep the pressure on. You warn the patient and ask the patient if it's okay if I continue. I can stop at any time. I always want the patient in control of the situation. But by applying this pressure, sometimes people say, oh, that's going up to my neck or down my arm. But after 2 or 3 minutes of pressure on this spot, I can actually release. And then I'll ask the patient to rotate to the right, and you'll usually see an increase in range of motion, and the pain scale is usually cut in half. So if he had an 8 out of 10 pain, you can get it down to a 4. You can also use this to find the trigger points that you're going to dry needle. Typically, I'll dry needle only with a needle, usually a 22 gauge. Finer gauges don't work as well. I don't know if it's a matter of the trauma caused or what. And sometimes after you clean the surface and put the needle, you're going to fan the direction, making sure to withdraw the needle almost to the skin and change the angle and plunge again. In this area, you have to be very careful because the dome of the lung comes up very high. So the general rule is you want to stay at 30 degrees or less. And with that, you generally don't run into problems. But in this area in particular, just be careful of that dome of the lung.